Hey, my name is Kelley Johnson. I'm a clinical sexologist. As a sexologist, I help people with sexual concerns and I welcome your referrals. So as a clinical sexologist, I visit with people, consult with people who are having sexual concerns. Some of the most common concerns I get include the inability to orgasm or different sex drives among partners, erectile problems, premature ejaculation. I'm also working a lot right now with parents and teenagers around cyber behavior, internet porn, and sexting. That is a wonderful referral for me. Some of the frequent questions that I get is, what's the difference between a sex therapist and a sexologist? Well, as a sexologist, I work just with the sexual concern. If there are relationship concerns, I will refer that out to a therapist. Many sexological problems don't have biomedical origins, which makes it very difficult to treat from a medical perspective. I use non-medical psychosocial methods in order to help the person meet their full sexual potential. What is a private consultation like? Well, we meet here in my office at 24 Arlington Street and we'll talk for about an hour. I'll get information regarding the person's sexual concern and a little bit about their history. I then will provide them with accurate information around their concern. In addition, I'll give them some homework that they can do that addresses their concern and begins to move them forward. For patients or clients who cannot come to the office, I can Skype my appointments. Another question I get is, how much does a consultation cost? A consultation is $95 for an hour and unfortunately is not covered by insurance. Why would a referral be good to me? One is I recognize that you as physicians and healthcare providers, some of you aren't trained in sexuality and most of you don't have the time to talk to your patients about sexuality. I do. That's all I do, is talk about sexuality. What might you hear from a client that would indicate they would be a good referral for me? One might be, I'm having a terrible time reaching orgasm and I don't know how to talk to my partner about it. Another statement may be, I'm not able to stay erect long enough in order to satisfy my partner and it's driving us both crazy. Or, my partner wants sex all the time and I'm just not interested. I don't know what to do. Or, I have so little sexual confidence, I'm not able to form intimate relationships and I want that to change. Or you might hear a client say that during sexual intercourse they have vaginal pain or they feel nothing in the vaginal region. All of this would be a good referral for me. Early ejaculation is another problem that I deal with commonly, helping men learn to have better control and be able to experience their erection longer. One of the most common referrals I get is when a woman goes to her doctor and at the very end of the appointment leans in and says, oh, and my husband wanted me to ask you, can you give me anything to make me want sex more? That's my most common kind of client that I see. Other issues would include issues around sexual orientation, gender identity, sexual confidence, anything like that. Anytime that a person wants to talk about their sexuality, it would be a good referral for me. How can you refer a client to me? Call me with the information from your patient and I'll take it from there. I will call the patient, follow up, and we will set something up. My name is Kelley Johnson. I'm a clinical sexologist and I welcome your referrals. Thanks.